As the number of uninsured Americans continues to climb, drug coverage remains an important issue for presidential candidates and policymakers. But the drug industry wants to have a role as part of a public-private partnership. How will collaborations between private industry like drug companies work with the public to help the uninsured? Welcome to Inside Healthcare on ReachMD XM Channel 157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and with me today is Roba Whiteley, Executive Director of TogetherRx Access. TogetherRx was created by some of the world's largest drug makers, including Johnson & Johnson, AstraZeneca, and GlaxoSmithKline, as a way to provide discounts on brand-name medicines for those having difficulty to pay for their prescriptions. Ms. Whiteley became Executive Director of TogetherRx in July 2004. Roba Whiteley, welcome to Inside Healthcare on ReachMD.
Well, thank you, and it's a pleasure to be here with you, Bruce.
It's great to have you. So tell us about the task at hand. Drug companies seem to have some success with discount cards in the TogetherRx program in 2004 that a lot of people heard about before full Medicare coverage went into effect. I guess it's been 2 years now, as a way to provide seniors with a benefit before full Medicare drug coverage was launched. So now TogetherRx seems to be wanting to have a voice in the debate over covering the uninsured. Tell us a little bit about how this would work and what would be a good scenario for the pharmaceutical industry to be involved here.
It's a pleasure. You know, Bruce, in 2002, 7 pharmaceutical companies came together to create the largest and most comprehensive prescription savings program for Medicare beneficiaries who didn't have the benefit of prescription drug coverage. That program, TogetherRx, was available until Part D became available, the prescription drug benefit under Medicare. And during that 2.5-year period, over 1.5 million Medicare beneficiaries saved in excess of $1 billion, I repeat, $1 billion on their prescription medicines. This was a free prescription savings program. The card was free to get, free to use. And once we found this population, the Medicare population, had the benefit of coverage, those same 7 companies plus 3 additional companies came together to now address the next unmet need, which is the non-Medicare uninsured population, the population that you hear so much about as we're hearing our political debates today. They're spoken about as the 47 million Americans who don't have the benefit of health care coverage. So it's this population, the non-Medicare uninsured, that I'm delighted to talk about with you today and to talk about how TogetherRx Access is helping millions of people save money every day at their neighborhood pharmacies on the medicines they need to take care of their health.
So in a perfect scenario, or as what some of the political candidates are talking about, a whole realm of possibilities, what would the pharmaceutical industry and TogetherRx, how could there be a bridge to pharmaceutical coverage that would be something that folks would be interested in, and in a public-private partnership, as you guys are talking about, where with the discount cards? I mean, could it be similar to Medicare, or is it a different scenario altogether?
We are not a program of coverage, as you've so correctly said. This is a prescription savings program where people save money on their medicines when they go to the counter to fill a prescription. This is not a permanent solution to the national healthcare crisis of being uninsured in America. What this is immediate help, meaningful help for people who are now paying full cash price every time they go to the counter to get their medicines. You know, we're signing up over 10,000 people every week across the nation in this program. That's a very impressive number, but you know, it's not enough. So we work every day. We work every day with patient advocates. We work with the medical community. We're in clinics. We're in emergency rooms. Our applications are in doctors' offices across the nation. We're working with physicians' assistants and nurses and social workers. We even outreach through the people at the counter who greet you as you come into a clinic or a doctor's office, or who say goodbye to you after you've been in to see the healthcare professional and they've given you a prescription. So it's a massive network of people, great people, who recognize this important national health problem, who help us get the word out and get people enrolled. And your listeners can go right today to our website, togetherrxaccess.com, and click on the front page to learn more about the program. And if they have people who would qualify for the program, meaning that there's someone who has no prescription drug coverage, that they're not eligible for Medicare, they're a legal U.S. resident, and that they have an income that is, for example, under $30,000 for an individual, or for a family of four, under $60,000, they instantly are enrolled. In fact, the website will give them a membership number which they can instantly take to their neighborhood pharmacy, save money right then and there while they wait less than 2 weeks to get their Together RX Access card.
Well, if you're just joining us, this is Bruce Japsen of the Chicago Tribune, and you're listening to Inside Healthcare on ReachMD XM 157, the channel for medical professionals. And we all know that there's a huge problem in this country of 47 million people who are uninsured, and the pharmaceutical industry has been working with an effort that they started in the Medicare program of offering discounts to the uninsured. And with me today is Roba Whiteley. She's the executive director of Together RX Access. And Roba, you were just explaining to us about how medical professionals can find out about these programs for their patients. Who are the people that are reaching out? Are these pharmaceutical reps and other people that are working for these 7 pharmaceutical companies to get the word out? And also, I think a lot of people, when they see discount cards, they're like, oh my goodness, is that really going to save me? Is it worth it? I mean, what are the kind of discounts you would get? Because a brand name cholesterol drug can cost perhaps $150 a month.
We have over 300 brand name prescription products available on the card, and most people save 25 to 40% when they use the card for those brand name prescription products. Now, you can also save money on generic medicines by using the Together RX Access card. And we now have actually 11 pharmaceutical companies who are members of Together RX Access. But I want to say that we're working very hard every day to bring more companies into the program so that more products are available, so that each person has the benefit of getting the right medicine for the right condition at the right time.
If you'd be so kind, I mentioned some of the companies. Maybe you could rattle off the 11 companies, because I would assume that perhaps through their websites, people could also find out about this program as well.
You know, they can find out about this program, but they can also find about other programs, both programs that are offered in the respective companies and other public and private programs, by also contacting the Partnership for Prescription Assistance, which is a clearinghouse for over 475 public and private programs. So I want to get that message out there and let people know about that. But the companies who make this card available and help people gain better access and affordability to medicines include Abbott Laboratories, a Chicago company right there in your own backyard, and 2 other Chicago-based companies, Takeda Pharmaceuticals and TAP Pharmaceuticals, AstraZeneca, Bristol-Myers Squibb, GlaxoSmithKline, the Johnson & Johnson family of companies, King Pharmaceuticals, Novartis Pharmaceuticals, Pfizer, Sanofi, Aventis, and we hope many more very soon.
This is Bruce Japsen of the Chicago Tribune, and you're listening to Inside Healthcare on ReachMD XM 157, the channel for medical professionals. And we all know that there's a huge problem in this country of 47 million people who are uninsured. And with me today is Roba Whiteley. She's the executive director of Together RX Access. Well, so tell us a little bit about what kind of a person enrolls in this program predominantly. I know that, one of the big problems with even people trying to get people enrolled in Medicaid, because the 47 million uninsured, unfortunately, there are people who are eligible for certain programs, but they do not participate. Are you finding that there is a certain group of people that are drawn to this program?
Bruce, we find that the person to whom we target most of our communications is the person we call the healthcare CEO. Or you can think of this person as the boomer woman. She's the woman who may be single or she may be married with children, But this woman not only is the one who tunes in and takes action about her own health, but she is also the communicator and connector with her broader community, with her neighbors, with her colleagues at work, with friends, with just about anyone she comes in contact with. You know, over 50% of this non-Medicare uninsured are under age 40. Many of them folks who've just graduated from college, young people who maybe could afford it, but they don't think they're ever going to get sick. They're bulletproof. And again, we hear stories about when young people, college-age students just out of college, or even people, young career people, get the card. Although they sometimes call, they sometimes visit the website, more often it's because a woman has led them to the number or the website, often their mother, or it could be a friend or a colleague. So much of our communication is focused on getting the word out to what we call the healthcare CEO, the boomer woman.
Well, that's fascinating because if you think about it, there are a lot of people who, especially today with the rising cost of insurance, are also buying plans that don't have drug coverage. Are you finding that, especially with the high deductible plans? I mean, can people work with their insurance company? I mean, can you have a discount card like this even though you have a certain kind of drug coverage?
If your coverage does not include a prescription drug benefit, or let's say on the other side you're in a public program like a state Medicaid program, and not all state Medicaid programs do include a prescription drug component. So if you don't have public or private coverage or support, you, yes indeed, qualify for the Together Rx Access card. And once again, the card is free, it's free to get, it's free to use, and enrollment is easy.
Well, Roba Whiteley has been our guest. She is with Together RX Access. It's a program that is reaching out through the pharmaceutical industry to reach the 47 million uninsured in getting some discounts on prescription drugs. The program, Together RX, became known to us through the Medicare program when the Medicare program was getting rolling about 2 or 3 years ago. And I want to thank Roba Whiteley, who has been our guest on ReachMD XM 157, the channel for medical professionals. We welcome your comments and questions through our website at reachmd.com, which now features our entire medical show library in on-demand podcasts. And I want to thank you today for listening.